Hi folks, and welcome to our Ask the Experts podcast. Today we're joined by cardiac exercise physiologist Gareth Jones, and he's going to be talking to us all about coronary heart disease. We'll cover things such as the difference between angina and a heart attack, the difference between a heart attack and a cardiac arrest, and also the various treatment options for people who suffer with coronary heart disease. So Gareth, first of all, tell us, what is coronary heart disease?
Coronary heart disease is a condition where the blood vessels supplying the heart are narrowed or blocked. This is also known as ischemic heart disease or coronary artery disease. These narrowings or blockages are caused by a gradual build-up of fatty materials in the walls of the arteries. This is also called atherosclerosis, and the fatty materials are called atheroma. The walls of the arteries are muscular and are easily damaged, which then causes the fatty materials to stick. A bit like priming something before the paint will stick to it.
So it sounds like there are various different terms that are used to describe coronary heart disease, but what are the main signs and symptoms that a person should look out for?
Well, the most common symptom of coronary heart disease is chest pain or angina. However, this pain can manifest itself differently in everybody. Some people describe burning, heaviness, indigestion feeling. Some people describe a dull ache, sharp pain in the arms, pain in the neck, or even toothache. The list is endless. It's a very good idea to listen to your body. It usually tells you if something's not quite right. Have you suddenly found that you are breathless when you're taking the stairs or going up an incline? Are you having some burning in the chest after eating? If so, these could be the signs to look out for. It's always recommended to talk to us or your GP or consultant if you're concerned.
So it seems there are a wide variety of signs and symptoms associated with coronary heart disease, and of course it's very important if anybody notices anything unusual for themselves to make sure they get it checked out. But is there anybody who is at risk of coronary heart disease? Are there people who are more at risk than others, or does everybody have the same risk?
Well, everybody is at risk of developing coronary heart disease, but that risk is higher if you have one or more of the following risk factors. You smoke, you have high blood pressure, you have high cholesterol, you are diabetic, you are physically inactive, or you have a family history. That risk is even higher if you have a male relative under 55 years old or a female relative under 65 years old with coronary heart disease. During the aging process, we all get minor damage or narrowings. However, this is exaggerated if you have one of the previous risk factors. You can also have more than one of those risk factors, in which case your risk will be that little bit higher.
So is coronary heart disease reversible?
There aren't any treatments that can stop or reverse atherosclerosis currently. These narrowings can't be melted away either. However, there are lots of things that can help to slow down the process and dramatically reduce the chances of having a heart attack. For example, medications can slow down how quickly the fatty deposits accumulate. Leading a healthy lifestyle and managing your other risk factors is vital to slow down the progression of the disease.
So you've briefly touched upon chest pain and angina and heart attacks, but what's the difference between angina and a heart attack?
Angina is a temporary narrowing of the coronary arteries, which reduces the blood flow to the heart muscle. This then causes the angina symptoms. This usually subsides after about 5 to 10 minutes of resting or after using your GTN spray or tablets if they are prescribed. This works by opening up or dilating the arteries to allow more blood to flow through freely. A heart attack is a complete blockage of that artery, which needs immediate intervention at the hospital. This used to be in the form of clot-busting medication. However, it's now more than likely that you will go to the cath lab for an angioplasty. The quicker you get treated, the less damage that occurs to the heart muscle.
So in terms of treatment options, what factors are taken into consideration to determine whether somebody has a stent, open heart surgery, or is managed with medications?
The decision on treatment options is taken by the cardiologist and the patient, or the patient's relative, depending on the circumstances. The cardiologist usually performs an angiogram so that they can see what they are dealing with. Coronary heart disease is a progressive disease, and there is currently no way of reversing the plaque buildup. It can be slowed down by medications and lifestyle changes, and some treatments can manage the symptoms. If your plaque buildup is severe or causing symptoms, or if you have had or are having a heart attack, then you may be referred for a coronary angiogram with or without stents or a bypass. A coronary artery bypass graft is normally carried out if you have severe narrowings in one or more of the arteries, especially if it's too small or tight to accommodate a stent, or if you've got several narrowings in the arteries. An artery or vein is taken from another part of the body, usually your arm, leg, or the inside of the chest, and used to divert blood around the narrowing or blockage. Successful coronary artery bypass graft usually leaves 75% of patients symptom-free of angina. That information is from the British Heart Foundation. However, benefits may be masked by soreness from the wounds for a couple of weeks up to 12 months following surgery. As with the coronary artery bypass treatment, a stent won't be able to fix the underlying disease, but it can reduce or resolve symptoms. Following the angiogram, if the cardiologist feels it is necessary to insert a stent, then a small balloon is inflated in the narrowing to push the plaque to the sides of the artery. Then the stent is inflated to reinforce this. It should resolve the symptoms of angina, such as chest pain, straight away. It is very unusual for a stent to cause any other problems. It is important to make positive lifestyle changes to slow down the process of further plaque buildup, as this could lead to further angina, further stents, or bypass in the future. You are also at more risk of having a heart attack.
So most patients will be discharged on some medications, often called secondary prevention medications. But what does that mean, and how do these medications work?
After a heart attack, you'll need to start taking medicines every day. If you had a heart condition before your heart attack, you might already be taking some or all of the medications that we're going to talk about now. You may be on an angiotensin converting enzyme or an angiotensin receptor blockers. These are ACE inhibitors, or ARBs for short. These help to make your blood vessels relax and widen. This lowers your blood pressure and improves the blood flow to your heart. You'll also be taking an antiplatelet medication. This helps to make your blood less sticky, reducing the risk of blood clots forming. You may be given two types of antiplatelet medicine, one which is usually aspirin. This is known as dual antiplatelet therapy, or DAPT. You will also be given another medication. The most common one that we see is called clopidogrel, and you will take this for 12 months following your heart attack, after which it will then be discussed about you stopping that medication. You could also possibly be on some beta blockers. These prevent the heart from beating too quickly and forcefully, and so reduce the strain on your heart. You'll also be on a medication called statins. These reduce the level of cholesterol in your blood and lower the risk of fatty buildup or atheroma forming in your arteries. The final medication that you put on is a glyceryl trinitrate spray, or GTN. This helps to relieve the symptoms of chest pain and discomfort, or angina. You'll be prescribed this in case you develop angina after you've been discharged from hospital. You'll need to make sure that you take these medications after you leave hospital, and you'll need to take most of them for the rest of your life. You may also need some other medications depending on your condition. It's important that you take your medication even if you feel well, as they will prevent another heart attack, protect your stents if you have any, reduce your risk factors for coronary heart disease, such as having high cholesterol levels or high blood pressure. A risk factor is something that increases your chance of getting a disease. It can help prevent or treat the symptoms of angina. It strengthens the pumping action of your heart, and it can help to reduce the risk of heart failure. This is when your heart is not able to pump blood around the body as well as it should. If you have any questions about any of the medications that you take, or you're particularly concerned about any side effects of the medications, please discuss them with us at your cardiac rehab sessions, your cardiac rehab follow-up clinic phone calls, or speak to your GP or cardiologist.
So if somebody's had a heart attack, how likely are they to have another cardiac event?
Well, many people wonder if they'll have another heart attack. Having one does increase the risk of having another, but this risk is greatly reduced by the right treatment. If you take your medications that your doctors have prescribed for you, and you follow a healthy lifestyle, you can significantly reduce that risk. Many people find that going to cardiac rehab gives them confidence and helps them to make the changes needed to lead a healthier life. It will also give you the opportunity to meet other people who have had a heart attack and understand how you feel.
So we sometimes hear about cardiac arrests in the media, and there are often lots of campaigns that run to help train people in CPR. But what's actually the difference between a heart attack and a cardiac arrest?
During a heart attack, there's a risk of developing a dangerous heart rhythm which can be life-threatening and sometimes lead to a cardiac arrest. A cardiac arrest is when a person's heart stops pumping blood around the body and they become unconscious, stop breathing, or they stop breathing normally. The most important thing that you can do to help save a person's life is to call 999 and start CPR. A person who is having a cardiac arrest may develop a dangerously fast heart rhythm which can be fatal. It's sometimes possible to shock the heart back into a normal heart rhythm by giving it defibrillation. This means giving the heart an electrical shock using a defibrillator. The paramedics or ambulance staff will have a defibrillator with them, but you can also use the public access defibrillators, or PADs for short, found in many workplaces, shopping centres, train stations, leisure centres, and on village halls. It's very easy to use a PAD. The machine gives clear, spoken instructions and you don't need a training course to use one. Once switched on, the pad will instruct you how to attach the pads, whether or not a shock is needed and how to deliver it. A cardiac arrest is an electrical problem. The person will be unconscious, call 999 and start CPR. A heart attack is a circulation problem. The person will probably be conscious, call 999 and keep them calm until help arrives.
So it goes without saying that both conditions require urgent medical attention, but CPR and defibrillation is vital for saving a life during a cardiac arrest. So a big thank you to Gareth for lending his time and expertise today. We hope you found this useful in answering some of your questions related to coronary heart disease.